Hey, welcome everyone to another episode of the FitFam podcast. As usual, Doug the Formulator, but this is not Miss Natural Olympia Hillary. this
Atta
is
girl.
this is a great friend, patent holder. We're going to be doing a little deep dive today, but this is Carmine Russo. Thanks for coming.
Thank you. Thank you for inviting me.
Yeah, and so a little bit different podcast today, but we're very excited because the concept of methylene blue is so huge out there today, and we get literally hundreds of questions about methylene blue at Optimal Health Systems, and what do we think of it, and because it's a chemical based structure, are we for it, are we against it? And so we're going to dive into that today. But before we do, and by the way, you're going to be excited about this information. I think it's going to really open your mind to some things that are possible. But before we get into that, as always, make sure that you click to subscribe and then the little bell down on there, click on it so that you'll always be notified when a new podcast comes out. And we have some exciting new podcasts coming, this one being the first. But we're going to be going into the super seminar. So we're going to have some more information coming in from some of the great speakers that are coming there. A lot of the great doctors, Doctors Brimhall Harris, great chemists that are coming in, some of the great thought leaders. A lot of you saw the last episode with Dr. Ben Hardy. We have so many others. So make sure that you hit that bell so that you can be informed when the new ones come out. But man, super excited today.
Good
And
thing.
being here in rural Arizona, many times our guests have to, they are in from different places around the world and they don't want to fly into Pima, but we're really blessed you actually live here.
I moved here. I live here. What kind of luck is that?
Super awesome. Super awesome. So, um, we're going to just jump right into it today. And again, the subject is methylene blue.
Correct.
And so, for the group that's like, we never even heard of that, what is methylene blue to start with? Let's go with just the basics of what it is, how it was founded, and then we'll kind of lead into some of the benefits of mitochondria and that. But really, right now, what is methylene blue?
So, with the history of it
Yeah.
going back, so it's over 100 years ago. Some scientists synthesized a blue dye. It's actually in anything that's blue, pretty much, even food dye blue, it's going to have methylene blue in it.
Wow.
And
But now we're told that dyes are bad, right? I mean, like,
well, this is a little unique. This one actually turns clear. This one. So when it's on it as a dye and it dries out, it's blue.
okay.
But if it's in liquid form, it could actually turn clear. So it basically moves electrons. It's some synthetic molecule that actually could move electrons. And when it's blue, it's considered oxidized, or it has an electron. And when it's clear, it's considered reduced, and it turns perfectly clear. It's
Okay.
clear, just clear like water.
So they made this methylene blue, this dye, and then what happened in order for them to realize it might have some benefit for humans?
Well, they were baffled by the way it could just change colors in different settings.
Hmm.
And so they started experimenting, giving it to people that were sick, and they found out through trial and error that it actually cured malaria. It was the only cure for malaria for almost 100 years.
Wow. So over a century ago, they found out it cured malaria, and it did it from a simplified, to not go into, extra detail. It did it by this electron transfer and destroying, I guess, some of the
Correct.
viruses.
The electron, yeah. So it adds energy. So first it gives the cells a lot more energy
Mm-hmm.
by giving them electrons, and it damages and kills the parasite, the malaria parasite, by pulling electrons from it and damaging their little egg walls.
Oh, okay. So 100 years ago, they learned that this compound, methylene blue, did that, but then why did it not just become the thing that's used, ever since then, no matter what? Like, what happened?
And you'll see anyone that takes methylene blue, when you go to the bathroom, your urine is going to be green or blue.
Mm.
Freaks a lot of people out. And that's not really the issue. I mean, if you were sick, who's going to care if it's going to get you better? But they were giving people 600 milligrams a day. It's a lot to get rid of malaria.
Mm.
And they stopped using it for malaria roughly in the 50s and 60s. They still use it around the world, but in the US, they did some research and they found out that, maybe more than 200 milligrams a day Could hurt the kidneys a little bit from trying to filter it out and clear it out of the body.
Okay.
But that's it. But still, that's compared to what people are taking today, that's night and day. I mean, it's
So
nothing.
people don't take anyone that
No.
goes and buys methylene blue, they're taking such a small dose. It's kind of like with everything in our world, right? The dose determines the poison or not, whether something's beneficial or not, even on the levels of certain vitamins and that, right? So basically, they found that the levels they were using 100 years ago and that for some people, that dosing was too high. So they quit promoting it for that. And this resurgence is because people are using smaller amounts and getting crazy benefits from it. Is that a
Correct.
fair statement?
Correct. They're using it for energy today, not to cure illnesses.
And they're
That's right.
taking it in much smaller
Much
doses.
smaller doses. Oh yeah, like
Okay.
in the form maybe 1 milligram a day, 2 milligrams a day. It's like a 1/100th of what is considered safe, and maybe fractions of what they were giving people for malaria.
All right. And so a lot of you already are saying, okay, this is something that Doug wouldn't be for anyways, because we're already talking about a synthetic compound, right? And all that. And you're actually right up until recently, as I've been following it for years. And in our world, with our thousands of doctors around the nation, they're always wanting to do things to help patients before they go the serious allopathic route and take some of these drugs that have extreme side effects and then surgeries and that. Like, what can we do to mitigate that, and even to the point of, okay, the normal, not just but the normal number one thing you do, the eating healthier, the whole foods, the exercising, taking your nutrients, your vitamins, minerals, enzymes, probiotics, fatty acids, based on the needs of the body. But there's still something there's this problem, whether it is bacterial, parasitic, or a mitochondrial deficiency, right? And any type of metabolic issue, there's still something there that normally the patient then would go and jump into maybe the heavily recommended or prescribed prescription that has major side effects, or again, like surgery. So where's that bridge? How can we still help as a holistic doctor, holistic medical doctor, naturopath, chiropractor, trainer? How can they still help people when they need something that normal basic lifestyle's not fixing before it goes too far? And so because of that, I've kept an eye on this for years now, pretty in-depth research on the last 3 years, but never wanting to pull the trigger of, oh, yes, this would be okay and that, because there's still, at the end of the day, it was an inorganic chemical compound. And I felt personally that it was not at a level that would be optimal health system, that we could recommend it, and even though many of our doctors were using it in different situations, but a lot changed. And before we get into the change, let's talk for a minute just about mitochondria.
Correct. I was going to say, let's talk mitochondria before we talk about what this
stuff
does.
So because mitochondria is a word for some people, it's new. It's like, oh, I've heard of it right back in school. And for some of you, especially our health professionals, they're like, well, the world, everything's based on mitochondria, right? Like that's the foundation of health itself. So to keep it simple, to start with, what is mitochondria?
So let's make it simple. So let's make believe that, everybody knows your body is made up of trillions of cells. Mm-hmm. Let's make believe we'll take one cell. Let's just take one cell. And let's make believe that cell is a car. The mitochondria is the engine.
All right.
So the engine of the car. The difference with the cell is that depending on the type of cells, like if a heart cell, mm-hmm. it might have 50,000 engines in it. And other cells might have 1,000 or 2,000 engines. So we'll call them engines. Mm-hmm. Okay. And that's what makes the cell run. Now the engine creates a chemical called ATP. Okay. And every cell in your body burns the same fuel. That's what people have to understand. We eat all different foods. We eat fat, we eat sugar. The body takes that, processes that down, gives either sugar or fat to the cell. And then the mitochondria, those engines, take that and create ATP.
Right. So whether you're a keto or you're a plant-based, it doesn't matter. At the end of the day, it's about ATP production. And I think we mentioned it a few times in the past, but think of ATP as this one molecule called adenosine, and then it has 3 phosphates, the adenosine triphosphate. And when one of those phosphates explodes, to keep it, we can understand it, that explosion is energy, and we get the energy from it. And then it needs to go find another phosphate to make ATP again, so we can have another energy explosion, right? So the simplified version is that everything gets converted to ATP in the mitochondria, and depending on the cell determines how many of the mitochondrial engines there is,
Correct,
right?
right.
Okay.
Because let's say a heart cell needs a lot more energy, so it has a lot more engines.
Awesome.
Okay. So the ADP
Mhm.
is we need that third phosphate to get on that to make an ATP.
Mhm.
That's done inside the mitochondria in something called the electron transport chain.
Okay.
So everything in the mitochondria, it almost acts in a way like a battery, where the mitochondria pump electrons on one side and protons on another, just like a battery. And as it builds, they want to come together. And when they come back together, it forces this ADP into an ATP
Mhm.
and forces out this energy.
Okay.
And then you have energy. And it's doing it fast, really fast.
So for the simplified version, you have the cells of the body, and within them are these engines, the mitochondria, and their job's to make more ATP, and they do it through a couple of the transfers, right? Once a phosphate's gone, it gives you energy, it needs more, it needs more, it needs more. And that's kind of where we're at right now, because there's multiple ways for these engines within the cells, these mitochondria, to make ATP. One of them we talk about quite often in the sports world, and now heavily in the world of longevity and brain function, that's creatine that we talked about a while back. Creatine in the body will help create more creatine phosphate to give the phosphates. But another way that the mitochondria does it is through just getting these electron transfer, right?
Correct.
So what does that have to do with methylene blue?
So methylene blue is an electron mover.
Okay.
And that's how it worked by curing malaria. That's how it works with a lot of things. Like we said before, when it's oxidized, it's blue. When it loses that electron, it's clear. But it doesn't have electrons. It's not a metal. It's not metallic. It just kind of it kind of has one, but it's not really like a metal that has a bunch of free electrons to move.
So let me ask you a question. If methylene blue stays blue, then that wouldn't necessarily be good. You want it to turn clear, which means it's actually performing that function. Is that a fair statement?
Correct.
Okay.
Correct. So what happens is even though when you urinate, your urine is a little greenish. It's really blue, but it's diluted with the
Right.
yellow and it turns green. When it's working in the mitochondria, it's clear. So they actually, in biology, they have a test to look for live cells or dead cells. If we were in a biology class and we were doing experiments on cells, we could take methylene blue and put it on the cells. If the cells are dead, the methylene blue stays blue. If the cells are alive, the methylene blue turns clear.
Oh, wow.
And that's an example of what methylene blue is doing. As soon as it gets into the cell, it acts as a conduit to move electrons. So that electron chain we were talking about with the negatives and positives, it kind of attaches right there. It almost is like made for it.
Okay.
And it starts cycling electrons a lot faster, creating more energy for the cell, more of this ATP. It helps it make more, and it turns clear. So if you see in biology, if you put it in a cell and it's clear, you know the cells are alive. They're respirating. The methylene blue is helping them make energy.
Got it. Makes sense. And that's a test that's actually been done forever.
Correct.
I remember doing that at
you could do
Eastern
that.
Arizona College and 101, right?
Exactly.
So that's really interesting. So you can kind of understand where we're going with this is that yes, methylene blue was made and has those properties at the beginning, the malaria thing, but the dosing was too much in that form for people, and so they now are microdosing it and seeing a tremendous benefit to provide energy to the cell. And what's interesting is that we've noticed, I mean, we can go there for a second, is that the healthier the person is, the more active their mitochondria is, and actually the more they can do in strength training and things to where they're building up the mitochondria strength within the cells and that, the less of the effect of like feeling this burst of energy that people have, and the more that people have a level that they can increase as far as their fitness or health, the more benefit they feel.
Yeah.
And
it seems that, so the idea is this, methylene blue, if you're really healthy, well, first, let's just make one statement here that all these engines in your cells that collectively every day pretty much create your own body weight in this ATP chemical. So it's cycling so fast,
Right.
you're creating your own body weight. So if someone is a little tired, they might just be making just a little tiny bit less and you'll feel tired. So a little bit of methylene blue could help fill that gap.
Okay.
And then you feel like you're energized. Where if someone is really healthy and energized, their engines are firing off fine. And if you take methylene blue, maybe you'll feel a little more energy, but you already have plenty. And your body says, maybe we could tone it down a little and turn some of those engines off because we got this methylene blue. But
Right.
but if it was in reverse and you have a big deficit, that methylene blue could really fill the gap, and you will feel it.
And that's why, we're talking previously about being in this field of helping people reach their optimal level of health, optimal health, or to have more high performance moments each day. You have to get wins for people. And a lot of times as we go through life and our health degrades because our habits aren't where they should be with our nutrition, our mindset, our exercise, our supplementation. And then we start trying to eat healthier, exercise, and we actually feel worse for a little bit. Sometimes it's so bad that people don't keep doing the good habits that's going to give them the energy. They don't make it through that time frame where their body's adapting and cleansing so that it can be healthier. And so we work to get people wins. We want to have an increased energy. We want them to feel better. They want to, reduce those uh, pounds really quick at first just to get a win. And that's where something like a methylene blue can come in from the energy standpoint, just to try to provide more of the mitochondrial efficiency, to make them more efficient at being able to make more ATP. And so for a lot of people, that's the kick they need to be like, okay, like I can mentally focus more on my eating habits, my exercise habits, and that. And they have that little edge that, so many people get so close and make their goals and then just they let themselves go. But if they can get that win, that can take them to that next level of health. So that's a great way to look at methylene blue from that standpoint. But I still had a problem with methylene blue because, again, it's still at that point where, okay, you have this compound and it's pulling electrons and giving electrons to the mitochondria and this process, but it's not acting holistically in the body. It's still not, for the sake of another word, organic, right? It's not organified. It's not, in methylene blue itself still needs things to make it work. It needs electrons. It needs things in the body. And for some people that might, not be the best thing in the world. So knowing that comes in Carmine and what happened in your world to fix that problem.
Well, I ran into a scientist, quantum physicist scientist, and he explained his invention to me, and it took a while for me to even comprehend it.
It was Reynolds, Mr.
That was
Reynolds.
Rod
Rod
Reynolds,
Reynolds.
and the product that we patented is called Reynolds Blue,
Mhm.
and we've had it for almost 5 years now. And that's was the funny story how I moved here, and then we started talking. And
Yeah.
you have the factory right here. I live right down the road,
Yeah.
and now we're making a product for you
Yeah.
called. And you'd say what it's called. What's the name? It's your product.
Right. Well, we are making in-house in America, in Arizona, right? Nano Blue, and optimal Nano Blue is a different form of methylene blue that fixes what at Optimal Health Systems was our biggest concern with anything, and that is making sure that it's organified, it's holistic, that whatever it is trying to do in the body, it can do without taking nutrients from the body or some of the positive compounds that the body needs to make it work. That we want to be holistic with it. And so when you met Mr. Reynolds and you got together and you got a patent, which I'm
Yeah.
huge on, what was it that you patented?
So what was unique about this product is that it takes methylene blue and it makes it work hundreds of times more efficiently than the way methylene blue works alone.
So you can use lower dosages.
Yeah, so use less dosage,
Okay.
exactly. And it's still pure methylene blue, but you use less, even less than what holistically they're using. There's less of that in there because it basically comes with its own energy source.
Okay.
Okay, so we were talking about electrons and how it moves electrons. So if methylene blue gets into your mitochondria, if your engines of the
Mhm.
body, and they want some electrons, they have to get them from somewhere. They have to make like a flow. And it takes a little bit of time for the methylene blue to connect and start creating that
Okay.
flow. And this one comes with its own flow source. So, and it's not like it's not like a battery that's going to discharge. Okay, it's more like It's more like a backpack of electrons.
Okay.
So methylene blue could start working immediately and create more like a wave function where it's pulling electrons and pushing electrons more efficiently,
Because it
way
has them
more.
with it
Yeah,
instead of pulling from them.
it's almost like the startup of is immediate.
Mm.
So when you take regular methylene blue, it takes a while for it to start working. When you take this patented product that Rod invented,
Mm.
uh, it starts working immediately, and it also cleans up the body at the same time.
How does it do that?
So if you think about this engine we're talking about in the cell, the
Okay.
mitochondria, okay, if it's damaged, if you were exercising a lot, if it's tired, if you're just sleepy, you didn't eat the right food, you feel tired, what's happening is the first part that's going to break down is this one piece called the electron transport chain. It's a little part of the engine.
Okay.
And that's the part that takes electrons. It takes high-powered electrons that are generated from the food we eat, and it pushes them into that grade I was talking about, where it pushes electrons and protons to create that ATP.
Okay.
That's the electron transport chain. What this product does is it could instantly attach to that and start feeding electrons. Methylene blue could attach, but has to find electrons. Now, before this happens, if you think about this, these high power electrons, you have a damaged piece of your engine, and these high power electrons can't feed into this part of the engine. They just wind up accumulating in the cell, causing damage. They're high charged electrons that damage a cell and add more tiredness to you. In scientific terms, they call it ROS, inflammation, reactive oxygen species.
So
ROS.
reactive oxygen species, a lot of times we talk about that, just basically oxidants, right? And they're so damaging to the body. They oxidize in the body, the cells, the tissues, they age it. It's much like if we have a piece of metal outside, it will start to rust. That's oxidizing, right? We all can remember that and know that reaction. It's the same thing that happens in the body. Our body will oxidize, right, from these oxidants. So reactive oxygen species are these oxidizing agents that we want to get rid of in the body. And in fact, it's so important to get rid of them that the creator made it so that a lot of foods have antioxidants in them. Foods that are more colorful, the fruits, the vegetables, the berries, those types of things, right? That have a lot of antioxidants in them, the blueberries, the cherries. What does that mean? That means that these foods have this extra electron to give to squelch, to neutralize the reactive oxygen species, these oxidants. So oxidants are unstable. They have at least one electron that's out there hanging and causing damage and looking for more to be balanced. And the foods that have been created for us, that if we eat enough of them, have these antioxidants they can give to it to neutralize. So it's so important that we neutralize the free radicals of the body, these oxidants of the body, that these antioxidants are abundant in nature. And big food actually wants us to not eat them, the big food companies and the pharmaceuticals, because they're so healing to the body. If we have these electron, these foods with the extra electrons that can donate them right to the body. So electrons are so critical that big food and big pharma doesn't want us to have them because it keeps us sick. It keeps us in that cycle. So now with this form of methylene blue, the Nano Blue, you have all these electrons.
Well, so we said before, remember we said that methylene blue is blue when it's oxidized, right? You mentioned oxidation. Okay. And it's clear when it's cleaning that up.
All right.
Okay. So in the Nano Blue product now, the patented formula, basically methylene blue comes with sort of, we'll call it a little battery pack of electrons locked up.
But yeah, it's more like a capacitor.
It's like a capacitor. We call it the biocapacitor. You told me to try to keep it simple.
But think Back to the Future.
It's simple. Like, yeah, we call it the biocapacitor because it has the ability to move both forward and backwards.
Perfect.
So what happens is if you have a lot of this ROS, so now we have a damaged engine, mitochondrial engine in the cell, and instead of it pushing the electrons in to make ATP to give us energy, not only are we not getting energy, we're getting ROS because those high-powered electrons are just leaking into the cell, maybe leaking out of the cell, creating inflammation. You're feeling tired, you're feeling sick. And so what this product does is it could mop those up. See, it's going to turn the methylene blue forwards or backwards depending on what's in the body.
And what's
So
needed.
so all these excess ROS particles, once this enters into the cell, before your Nano Blue product connects to the mitochondria to give it electrons, it might mop up all that ROS, boom, suck it in, and then connect and then feed it
Got it.
right to that engine.
All right. So I hope y'all are getting
I'm
this
trying to
because it's
keep it
really important. No,
simple.
you're doing great. And so let's go to, if you went right now into your search engine, the computer, go into, ChatGPT or Grok, you could go and say, give me the benefits of methylene blue based on the research, so that, nothing's spoken here that you couldn't go and look and see. I put in and just said, hey, give me the top 6 complete research-based benefits of normal methylene blue, even without the electrons like the Nano Blue has, not being organified. And it was amazing to me because we're talking about the mitochondria. The first one came from a huge study that was done on anti-aging, and this was done in 2021, and it said that methylene blue's role in mitigating oxidative stress via mitochondrial activity benefiting conditions. So what we just said,
Correct.
right, with the mitochondria, but what does it do? Because really, what's in it for me? Like, okay, my mitochondria are healthy or not? Like, a lot of us are like, okay, what's in it for me? Well, here's what it showed: the benefits of getting the mitochondria able to do their job better, to make more ATP, that it benefited neurodegeneration, memory loss, skin aging, because it blocked the UV damage, which a lot of people don't talk about. You're blocking the UV damage to the skin, right? And a huge one, which was promoting wound healing, which, we're so big on. If you can reduce inflammation in the body, you go a long ways of healing faster, recovering from exercise, living a lot longer life. One of the major causes of disease and degeneration and a shortened lifespan, when we're talking about that, is these problems with inflammation. And so just in that one study, it showed all these huge anti-aging benefits from taking just the normal methylene blue, which blew my mind. Was the benefits from it. And then it gets even further, like with the neural protective benefits, doesn't it?
Yeah. Again, everything, we could go through all these studies and we could point to every one of them and trace back to more ATP, more energy.
Mitochondria.
Yeah, mitochondria, more energy from those engines to create more energy for our bodies.
That's a
We
great
could
point.
look at it that way. And in almost any case, when you're not thinking straight, when your mind's not clear,
Yeah.
your engines are not working. They're not connecting. Maybe you have a neuron that's tired, it's not working, so you forget a memory. And more ATP is more cellular energy. We could go through each one of those 6.
Okay.
I bet you it's either going to be reduced inflammation or more energy.
Okay.
And that's what methylene blue does.
Let's challenge that. Second one, neuropsychiatric benefits. Methylene blue, antidepressant, neuroprotective effects, results in treating bipolar disorder in this study. I'm not saying, I'm just reading from the study. Memory and fear extinction training. So right on there, right? That's the benefit
Energy.
of the mitochondria
Yeah.
and the energy there, and helping with those pathways of memory, right? Getting those routes being more, basically it's like a road, and we're able to, a road that's broken at different places. Now we're healing that or fixing that and creating that nerve impulse.
So one comment I can make about the neuro stuff in the
Okay.
brain. So your engines in your brain are a
Mm.
little different than everywhere else in the body. They could only burn sugar. See, the engines everywhere else in all your cells could burn sugar or fat. But the brain cells could only burn sugar. And so methylene blue was studied, I don't know if it's one of these studies, to actually help with Alzheimer's. Because methylene blue, remember, if you can only burn one kind of fuel in the brain and it's only sugar and you have some damage, you don't have an alternative fuel. So methylene blue seems to go into the brain cells and help with memory, help with just cognitive ability.
Right, and they actually call it neuroprotective benefits, right? And that was an actual study on Alzheimer's, Parkinson's, traumatic brain injuries, right? Concussion, a lot of things we see with the professional athletes. And that was one, if people are looking it up, that was a study in 2018 that was done, the emerging role of methylene blue and a PubMed, you can look that study up. But that's a very important concept to hear. So one of the big benefits is the neuroprotective benefits. So as an electron cycler to boost respiration. That's what it said. Its exact words are methylene blue acts as an electron cycler to boost cell respiration, provide antioxidant
See,
effects,
yeah.
right, improving memory and so on. And basically each one of those studies really does come back to what methylene blue on the market right now is being promoted as, and that is a neuroprotective, brain health, energy formula that at the low doses makes sense. But again, personally and for optimal health systems point of view, to give it without the electrons available, at least over time, wouldn't necessarily be the best benefit. You want to be holistic. You want to make sure that you have a molecule that, again, is like Organifi, that has everything it's needed to make sure that it can and work. And that's where your patent comes into play, which is really exciting. So, at the end of the day, do I think methylene blue, let's even take away the organified version, right? The Nano Blue. At the end of the day, can methylene blue be beneficial? My read on it after all these years and looking is the answer is yes. But first of all, if all you did is take methylene blue, one, you need to do it in low dosing, and two, you need to make sure it's the right form of methylene blue. Let's talk quickly about that. There's two forms of methylene blue, just straight methylene blue on the market, way before we get to, the organic version, the patented version that. And what are the differences between the methylene blue that's sold most of the time, I think I have the numbers here we'll talk about, versus a pure methylene blue?
So basically, they're all selling the same molecule, methylene blue.
Okay.
The difference is the purity levels.
Mhm.
So when they manufacture methylene blue, there's a lot of heavy metals and dangerous chemicals in the mixture as they're developing it. So it just has to be cleaned up. So
So,
if you go to the fish store and buy methylene blue fish medicine, that's going to be, sold by the 55-gallon drum, and it's going to be manufactured really dirty, and they're not going to clean it up. When you go and buy, USP grade, pharma grade, it's going to be way more expensive, and it's going to be cleaned up. And then there's certain levels that the government came up with and said, hey, so many parts per billion could be you could have a little bit of formaldehyde, but it has to be below all these levels to considered pure grade to not harm the body.
Right.
Why would we take methylene blue? We want to take it to help the body,
Right.
not harm the body. And so, yeah, if you look on Amazon, like seriously, if you look on Amazon, you really don't know what you're getting. I think 6 months ago, a year ago, there was only 2 or 3 people selling methylene blue. I think, how many did we look today? There was how
So
many
there's
total?
280 different
280.
methylene blues.
That's
And
incredible.
based on what you said, I said let's do a search now on those 280. How many of them at least claim that they have third-party validation that it's pure, human consumption grade? You want to call it pharmaceutical grade, human consumption grade. In other words, there's no possible chemicals, toxicities as far as heavy metals in it and that. And 28, so 10%
10%.
of the 280 companies claimed. But then recently I saw a lot of those that claimed are
Resellers of the, or
they're cut and pasting the third-party certificates from the companies that are actually doing it and putting that on their site, and they're truly not doing third-party. They're just saying, hey, yeah, we have third-party testing, and it really isn't done on their product, and now the FTC is getting involved in busting them.
I
It's
want
hard
you
to know
to
who's
I
telling
want
the
you to
truth.
explain, and the reason why I'm making this here in your facility is because your facility is a third-party tested facility. So I'm going to talk just a little bit, and then you explain what your facility does and why this
Okay.
methylene blue is probably the purest. So you could go on Amazon, and like we said, there's over 200 people selling it now. 280,
280.
almost 300. Now, it's got to say USP grade or pharmacy grade. If it doesn't say that, you're buying fish medicine. You don't know what kind of poisons
And they
you're going to be
better
taking.
post the actual third
And
party.
so even if
test.
they say USP grade or pharmacy grade, you still don't know if that's really what it is. If it says produced in a GMP facility, which Doug has, third party tested, which Doug did, then you know it's accurate. So when I started manufacturing this here, I had to take all my chemicals here. They sat in his facility almost a month. So all my paperwork came in. USP grade, purity grade, all the paperwork. It doesn't mean anything. He said, okay, put it in that room. I need to test it. Right. And then you went and maybe you explain how that process works.
Well, everything that comes into a facility like ours, right, that we are GMP certified, FDA regulated, it'll have its own certificate saying, we are vitamin C and there's no impurities, no chemicals in it. We are methylene blue, there's no impurities in our chemicals. We all have that to begin with. And some companies don't even have that, but that would begin with. But we don't believe it. And we put in a special caged area, our quarantine area, and then we will send it out for third-party testing to ensure that it's exactly like the the certificate that came in. And we will do it ourselves. We'll do our own testing on our infrared spectrometer. So we'll have 3 different parties. The party that we bought it from, that nutrient, whatever it might be, methylene blue, the compounds within it, the silica, everything. And then it'll have its own certificate. Then we do our own testing and then we send it out third party. Once all 3 of those are in place and they all match, then it can leave quarantine to go into the special room we built that you
Correct. That
go
we
into
make, that
and
we
make it,
manufacture
right?
now. And if you just think about what Doug does here, it almost makes no sense for anybody anywhere to buy anything that you're going to ingest that's not third party tested in a GMP facility, because you really don't know what you're getting. So you just don't know. Just because someone if I'm a company and I want to make vitamin C and I buy a chemical from some other company, whoever knows where that came from, and it comes with paperwork and says it's vitamin C, do I just throw it in a pill bottle and sell it to you and say it's vitamin C? If it's third party tested, I've got to send that out to another third party, not affiliated with me, to check that label is correct before I put it in a bottle to sell to you.
Exactly.
And that's what Doug does here on all his chemicals.
And the thing is that it's interesting in the world today is I don't think it had to be what I'm going to tell you right now. In the past, you had to go to this route, but now, because there's so many companies and sometimes some really good people that start companies, they're not in it to hurt anyone, right? Good people, good companies, but there's so many companies. In fact, let me reverse that. There's so few companies that actually make their own product from scratch. We're talking about your vitamins, your probiotics, your enzymes, whether it's methylene blue, any product, any formula. Very few make it from scratch. So you can have a good company that's trying to do the best they can, but because they don't make it, they're trusting other companies and people to make it. And those companies are trying to make money 100% on what they're selling. So they're trying, for the most part, to give you a product they make the most profit on. And if they can skip corners, most of the time they do, because these are just companies in it for the money. And then you have the good mom and pop that wants to try to do good and come out with a good product, but they really don't have control because they're not a GMP approved facility that's making it there, and they have the government oversight from the FDA and that to ensure that all of the processes are performed right. So, honestly, we'll just stick to methylene blue today, but here's just a takeaway for the podcast, and that is anything you consume in your body that you're taking to benefit your health. Like, hey, I'm taking this because I actually want to improve my health, right? You're not taking the capsule because it tastes good. You're not taking methylene blue because it tastes great and that stuff. You're taking it to improve the health of your body. My suggestion is to make sure that you've done your homework, that wherever that product's coming from, again, from vitamin D to whatever, to methylene blue, that it's from someone that's making it, that's following the rules and even going past the normal rules to ensure that it's pure to the body so it can do its job. And the great thing about Nano Blue is that, again, I still wouldn't pull the trigger on it, even though we could make the purest methylene blue there is on the market. It wasn't good enough. And until you showed the patent and we went through that process. In fact, the first time you brought it to me, I didn't pay much attention to it because I didn't hear. I thought, oh, methylene blue. I thought it's another methylene blue. But then once we got talking, I'm like, well, this is an organified version where you fix the problem to where you've built that matrix around it that has the electrons so that it can get in the body. And then the third issue that I had with it was, one, methylene blue had to be pure. The second was, the electrons, which you fix. But the third was actually the absorption, because you're asking the body to absorb this compound that's neither a carb or protein or fat, which means that there's a good chance, a high chance, just kind of like with peptides and that if you take it orally, it's going to get
Yeah.
destroyed in the gut. And so I'm like, come on, really? It's not, the body's not going to protect it because of it being a fatty acid, an amino acid, or glucose, and it's going to get destroyed. So really, how much is going to get in? What did you do about that?
So we have our whole product is wrapped in a liposome.
Okay.
So it's liposomal. It has its own energy source.
Mhm.
And it's all wrapped in a liposome. So the body, it's almost you can say it tricks the body in a way, because the body looks at it like, oh, this is a nice chemical. Let me just take it in. The cell says, wow, this is nice. Let me take this chemical in. It's made from the same material that the cell walls are made of.
Mhm.
So when you ingest it, it doesn't look like a foreign chemical to the body.
Okay. So let's take it to the nutrition world. Okay. So when you eat proteins and carbohydrates, the way the body works is it'll take those macronutrients and break them down, and it'll process them through the liver to make glycogen, to make amino acids, right?
Correct.
But when you eat fats, the body doesn't use the same process, and it's absorbed into the bloodstream, and that's where the process happens, is in the bloodstream. That's why we can do people's live blood and then have meat like a little bit of a Big Mac, and then do their live blood a little bit later, and you can see all these fats in the bloodstream immediately, like immediately. Why? Because fats are handled differently in the body. And so when Carmine talks about a liposomal, in the case of something like a methylene blue, what you're doing is you're saying, okay, to the body, here's this fatty acid matrix. Okay, it goes right into the bloodstream. It doesn't get processed through the liver. And so that allows that process to happen. I'm not the biggest fan of that with carbs and proteins, by the way, the liposomal vitamin C's and all that. I'm a bigger fan of it with something like this, to where, okay, got it. We're going to be able to make this liposome, this fat, shrouded, and we're kind of hiding the methylene blue and all the electrons in it. And then it goes right into the bloodstream, and the body's like, oh, this is, now it
Correct.
can say, oh, this is awesome stuff. It gets past the guards of the acidity of the stomach for a reason, just like fats do. Like your body naturally bypasses these guards when you eat good fats, your avocados, right, your coconut. So it's a natural process of the body. So you're just following that process. So the third strike to methylene blue, the reason we never pulled the trigger on it was that, and you solved it also.
Yeah, with the liposome. So yeah, Doug's correct. You told me to keep it simple. But yes, the liposomes do not go into the liver. The liver could break anything down. It's just a big chemical factory.
Yeah.
So to get this methylene blue around the liver functions and get it right into the bloodstream where it's needed at the cellular level to help clean up ROS and create more ATP. That's what it's needed.
Yeah.
And so, yeah, the liposomal. So even if we went on Amazon and we eliminated all the ones that didn't say third party tested, and we looked at those 28, how many of those 28 are probably liposomal? Probably none.
Yeah.
You have the only product here.
Probably none.
Yeah, you have a third party tested methylene blue with its own patented battery pack that's wrapped in a liposome.
And that's the only reason we carry it. And we did create a special room that Carmine is the only one in the world that comes in and makes it under the patented process. And we do have it in place that if you got hit by a truck, that we'd be able to do it.
We have a backup plan.
We have a backup plan. We have a system.
But
the same way with the entire company, right? But the key is that I really didn't want this to be it's really turned almost into like, hey, here's our product, buy it. I really want this to be a lesson of there are things that are beneficial to the body that we can help the body get wins, help get that energy, get the mitochondria functioning like it should, to be able then to spur you on to make those healthier choices, to do those things. And when would you use methylene blue? I guess we're talking about two different times, right? One is for the ATP,
correct,
all the neuroprotective longevity benefits, or put it in your medicine cabinet.
Well, yes. I mean, I don't know. A lot of people right now, no one's talking about its benefits for curing viruses or killing viruses.
Right.
So I don't know if we want to go there. But what we could talk about more on the mitochondria, which is everyone's ATP production, because I think it's clear from if anyone made it this far, that they understand that there's all these engines inside a cell that have to create this ATP, that any one of the 6 things you came up with all relate back to ATP, and that regular methylene blue does connect to this electron transport chain and create more ATP. What's different in Nano Blue, or your product or our product now, is that it comes with its own little energy source.
Right.
It's wrapped in a liposome, so it'll go into the cells a lot quicker, and it mops up this ROS and connects to the electron transfer a lot quicker. You know, I had a video that we said we might not want to put on this podcast, but maybe we should look at it.
Let's do it. Let's finish up with this video because it's extremely powerful.
This video, let me find it here. So what this video is going to demonstrate, let me turn the sound off, you don't want to hear me talking in it, is it's going to demonstrate, and we'll put it up on the screen, but what happens is if you take yeast cells.
Okay, so you took 2 bottles.
Yeah, so I have 2 bottles. We have 2 bottles.
Right.
And we put sugar water in there with yeast.
With yeast.
And the yeast starts respirating. Okay, and the yeast is no different. So the yeast, just so everybody knows, whether you're a plant cell, a yeast cell, everything has mitochondria and everything lives on ATP.
Okay.
It doesn't matter what you eat. If you're a plant cell and you work with photosynthesis, that's just a way to make glucose for the engines in that cell to make ATP. Right. Everything on this planet lives on ATP. So the experiment works just fine with yeast.
And so the yeast is representative, in part at least, as the cell.
As a cell, correct.
Right.
A yeast would be cells.
But it's a cell. Picture the cells of the body. That's what the yeast is representing.
So basically what happens is, to give you an example of respiration and ATP generation. So these are 2 test tubes with yeast in them respirating, and we put a couple drops of methylene blue in one.
Regular methylene
Just
blue.
regular methylene blue.
Okay.
And then the Nano Blue, which has its own energy source, which is able to mop up ROS and feed into mitochondria.
So both of these you're putting right at the cellular
Correct.
level.
And we made it clear, no pun intended, that when methylene blue is clear, it means it's working. When you put it in cells, right? If it turns clear, it means it's connected and generating energy. So this video here shows the difference of methylene blue. I mean, we'll probably put it, maybe we could do it like this. Let me see if this works. So here's the experiment showing that's right where you see this is blue, regular methylene blue. This is already turning clear. And look at how in the matter of just a couple minutes, it turns to clear.
So it's about 3 minutes or so?
2 minutes. In less than 2 minutes, Doug's Nano Blue turns clear, and the methylene blue is still in there trying to figure out what to do. And you can
doesn't mean it's bad. It just means it's taking
it's
longer,
taking time. Well, remember now, if this was a cell that was hurt, that had a lot of ROS, then this is going to turn clearer way faster. Because it's going to mop it up a lot faster and pump in a lot more. So if you zoom in, you could also see how much more respiration this one has than this. So look at the bubbles on this one versus the bubbles on that one.
So the bubbles on the straight methylene blue aren't as pronounced.
Correct, because this turned clear way faster. I'll do it again. You can see regular methylene blue. The second you put it in, it's already turning light. It's already connecting and working. And then as you just pass a minute, look at that. It's gone. It's clear. Right. It's still in there. It's just creating way more energy for the cell.
Awesome. That's a great demonstration. We're actually going to do that live at the Super Seminar.
Yeah, I'd love to do that. We mix it all, play like scientists.
We'll do it. But it's a great example of, it's one thing to talk about things, and a lot of you know the pudding test, right? My favorite thing to do for decades of like, you need to eat more raw food because raw food has enzymes. And when you don't eat raw food, you eat food that's cooked and processed, it causes almost every disease. And so you have the pudding and you put enzymes in one and you stir it and it pours out because it digests the food. And then the other one, nothing happens, right? And to understand it from that perspective, like, okay, it's one thing to say this, Carmine, I got it, the story's great, blah, 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 capacitor, all these things, but then to actually show it with the yeast cell. So we'll finish up here, but let's explain really quick. I understand yeast cells and the respiration and that, but actually the difference between a yeast cell and a human cell, it would actually have been better, wouldn't it?
Oh, yeah, exactly. So the liposome that we're wrapped in, the cell walls of a yeast cell are way different. So it's actually way harder for the Nano Blue to get into that yeast cell to even create that ATP. If that was a mammalian cell or one of a cell from a mammal, it would have went in there in microseconds.
It would have been a lot faster
it would have turned
because the
instantly.
cell
Correct.
is more of a
Correct.
fatty, right?
So the
Lipid
liposome
layer.
actually hurts this experiment a little bit, and it still proves how much more efficient it is.
Yeah, that's phenomenal. So the takeaway for everyone I'd like you to have today is twofold. One is that when you're working to improve your health, you want to get some wins, right? You want to get that a few pounds of weight loss. You want to get that energy boost. You want to do those things, and helping the mitochondria of the body through fasting, through just really drinking more water can help, or something like the right form of methylene blue can help boost the mitochondria. There's certain nutrients, turmeric, other nutrients help boost mitochondrial health. All of these things are ways to get some wins, to be able to feel that energy, to get that little boost, to spur you on to keep making healthier choices. So one, get some wins. This is one of the ways to do it, is to boost mitochondria, however you want to do it, even just going out in the sun and doing that. But again, you don't want the oxidative stress from the sun. You just want the benefits to the mitochondria. So you need to make sure that those electrons are present. The second takeaway is that whenever you're looking to do something for your health, some improvement in your health, right? That you're wanting to take probiotics, you want to take something that, okay, I've heard the research, I want to do this. The world has changed then a lot more than it was, 25, 30 years ago, especially in the health field. And you want to make sure that you're working with a company that is family owned, not pharmaceutically owned. You want to make sure that you have proof that they're actually making the formulas as a GMP approved facility, that they're doing everything in their power to keep the product organic, meaning that they're obeying the laws of nature. You're not making a synthetic vitamin C that's pulling from the body to make it work. You're not taking in a methylene blue that then is pulling from the body to get its benefits, that everything is present. And if you do those two things, then as long as you just have that mindset of wanting to be healthier for yourself, for your family, for the good of your community and the nation, you're going to be led to the right products, the right companies to help you get there. And if we can help you, then that's what it's about. Man, it's an honor to be able to have Carmine here with us in town.
Can I congratulate your staff?
Oh, yeah.
So can I talk a little about your operation? Is that okay?
Okay, we'll finish up with that.
We'll finish up real quick. So when I met with Doug and we talked about this product, Doug said, well, maybe we could do something in my place. And we came here and we looked at his facility, and with the help of his people, we were able to manufacture this product exactly to specs, for what we made. We weren't able to make it the way it is for the amount of money that you're selling it for forever. And with the help of Doug's people and his facility, we came in with a price point right in regular methylene blue. So not only is it liposomal with its own battery pack, third-party tested pure,
Your patent.
with the patent, your price point is where everyone else is just selling straight up methylene blue. So I think this is the best product ever to hit the market, is this product, Nano Blue.
Well, thanks. We hope so. We hope that will do good for people. At the time of this podcast, only the top doctors in the nation have testing it, and it's been absolutely phenomenal results that we're hearing back from them. So much so that we're really going to have to be specific on which testimonials we show, because we want to be able to keep this in the market. We want to keep having podcasts like this where we can dive into the true research that anyone can look for, but give people hopes and abilities to look at their own health and take charge of it themselves, to look and do as much as you can on your own to improve your health, to take it to the next level, so that at the times you do need the allopathic medicine, you need someone to sew you up or need some extreme thing, that you can go and do that, but don't jump there too soon. And the only way to do that is to take responsibility for your own health, learn these things, and start applying them so that you're able to get your health to that level where you can really benefit everyone and be more present in each moment, because that's what it's about. Be more present in the experiences you have each day that creates memories, the one thing that you are able to take with you. And again, thank you so much for being here. I'm Doug, the Formulator, and we miss Natural Olympia Hillary. She'll be back next time and brighten up the room. We just had us two guys here today to put up with. Hopefully you stayed with us.
I know they miss Hillary.
Yeah,
Sorry.
they do.
Sorry, guys.
She'll have to do one on her own so that you can benefit from her. But again, thanks so much, Carmine, for being here.
Thank you.
And if you're at all watching this before the OHS Super Seminar at the end of September in 2025, highly recommend that you get there. Carmine, we're both going to be on stage. We're going to be doing this test, going a lot deeper dive that we couldn't do here today,
Yeah.
right? And have a lot of fun with
And
it.
you might let me do the yeast experiment on stage?
We'll